is Jana Declercq and I'm an associate professor at the University of Antwerp, and I'm an ES Fellow from September until December 25. I'm a linguist and a communication studies scholar primarily interested in health communication. In the past few years, my main topic was chronic pain communication in clinical settings, but I'm also more broadly interested in health communication and health and illness discourses in other contexts, including in social media and mass media artifacts, as for instance reflected by my work on infertility on Instagram. The key assumption underlying my work is that language and the social world shape each other, and that we can learn about social worlds, including healthcare contexts, by using a linguistics toolbox, by focusing on language. And I have a few examples to explain that. For instance, consider the term that we use to refer to the person who's seeking help in the medical system. Is that a patient or a client? I guess you can sense that there's already different roles and responsibilities projected onto that person depending on the term we use, and that they also maybe come in for different illnesses or different issues or symptoms that they're dealing with. Or in my work on chronic pain, we also see that patients and healthcare providers use a range of metaphors to talk about the pain experience. Some refer to it as a prison, others as a ticking time bomb, or others also use journey metaphors. It's a journey you're on. Or one patient also referred to it as a dirty bathrobe that she was never able to take off. And these metaphors also uniquely highlight different aspects of the pain experience, and thus can tell us something about what it is to live with pain. And then finally, this kind of meaning making can also be much more implicit. It can also be encapsulated in the pronouns we use, for instance. Consider, for instance, the first person pronoun, plural pronoun we, when a healthcare provider uses it. For instance, in a sentence like, "We know from biomedical evidence that treatment X works." Here, the we refers to the healthcare provider, but also to the medical establishment, more broadly, other healthcare providers and biomedical researchers who have spent time on trying to find out which treatment works best. But if a healthcare provider tells you, "We need to lose weight," it's actually about you, and that use of the we is a way to what we call mitigate that message, to kind of soften it, to hedge it a bit, and to make this face-threatening situation a bit easier for you as a patient or client to digest. So with that understanding of language and what language can tell us about the social world, in combination with insights from biomedicine, from philosophy and anthropology, and a range of other disciplines, I study healthcare communication, and I'm very excited to be at the ES to further develop that perspective and learn more from others and exchange and collaborate.